Well, hey, Doc.
Hi, Miranda. How are you?
I'm doing good. It's Wednesday.
It is Wednesday.
How are you?
I'm great. Let's talk about x-rays, since you caught me in the middle of looking at x-rays.
X-rays.
Yeah. So one of the more common questions we'll have from patients when they come in, if they have pain or if they've been diagnosed with something related to their back and neck in the past, is, do I need x-rays? And x-rays can be really valuable and really important in some circumstances, but not every patient needs an x-ray. So what we do is, when we talk to a patient about what they're going through, is ask some kind of specific questions to get an idea about, is there something going on here that might make x-rays beneficial to make a more accurate diagnosis. A lot of times those questions relate to history of past trauma. So let's say, a gentleman comes in the office and he's got chronic back pain for 20 years and he's in his mid 50s, and then we're talking about his pain, and then he says, yeah, I'm getting bad sciatic pain, it's going in my leg. Maybe he has paresthesias, meaning like he can't feel like his feet, or if he has any kind of muscle weakness or any kind of neurological signs that might be indicative of like a back issue that's putting pressure on a nerve going in the leg. And then he says, yeah, I had, I have a history in the military, and I had injured my back a couple times when I was in the service, had some bad falls, some compressive injuries. In a case like that, we might want to do some films. We do x-rays in-house, or patients might bring their x-rays in that from a previous provider, and I'll be happy to look at those x-rays. What x-rays tell us is there something going on structurally that might limit the body's ability to get to like full functioning? And that can be important information. We'll do x-rays of the back, the lower back, the middle back, and the neck when necessary. But not every patient needs an x-ray. If someone wakes up one morning and they have neck pain and they haven't had a lot of pain in their life and they don't have a lot of history of trauma, and we come in and we talk to them and we find out what's going on, typically I won't take x-rays on someone unless there's a sign that they might need it. And I think most of our patients appreciate that, because x-rays are an additional cost. Whether or not insurance helps them pay for that is kind of dependent on the insurance policy.
Mm-hmm.
So we'll do films if we really feel like it's important and it's necessary, but not everyone needs it. This gentleman here that we have x-rays on, he had some lower back issues, and these pictures were important because then I could see some misalignments throughout the pelvic bones. We could see changes in his curvature, and even like maybe a little compression and degenerative changes in his lower back joints. And that information is important for a chiropractor, because then I know how to adjust and what techniques might work well for them. Once we take the x-rays, we usually don't have to re-x-ray, because those films are going to be pretty static for a long period of time. We might re-x-ray every few years, or if someone has a new trauma, we could always do films again if we want to have a comparison view. So x-rays are something we do in-house. It's not a main focus of every patient. It really depends on a case-by-case basis, just another way we use kind of diagnostics to figure out what's going on with people.
Well, that's cool.
Thanks, Miranda.
Take care.
Mm-hmm.